What causes your kidneys to stop working? My name is Ellen. I am a retired registered nurse and have worked in and out of the dialysis field since 1968. You may have been told by your doctor or a nephrologist that you or perhaps a loved one has chronic kidney disease, CKD, or end-stage renal failure, ESRF. This video covers what can cause your kidneys to fail. Our kidneys are so efficient that you can lose 90% of their function before symptoms show up. This can mean that there are many people who don't know they have renal disease CKD, chronic kidney disease, or ESRF, end-stage renal failure, until they have symptoms, or it shows up on a blood test when they see their GP. Your kidneys are found on either side of your spine below your ribs and behind your abdomen. They are around the size of a clenched fist. There are two ureters leading from the kidney to the bladder. They transport the urine to the bladder where it is stored until it enters the urethra when you urinate. Our kidneys may be small, but they do a lot for us. What can make them start to stop working? Hypertension, high blood pressure. High blood pressure is one of the leading causes of kidney failure. Blood pressure is the force of your blood pushing against the blood vessels in your body as the heart pumps it out. High blood pressure is an increase in that force against the vessels. If that pressure gets too high, you will be told you have high blood pressure. That can be because your vessels are narrow, stiff, or clogged, or there is too much fluid in your blood. When you go to the doctor or see a nurse, they may tell you what your blood pressure is. There is a top number, which is the pressure as your heart beats and pushes out and through the blood vessels. The lower number is when your heart is at rest between beats. Ideal blood pressure should be less than 120/80 and high blood pressure anything above 140/90. The increased pressure can damage the blood vessels, making them narrow and hardened, reducing the blood flow to the kidneys and damaging the kidney tissue. The increased pressure can damage the filters in your kidneys, the nephrons. Inside the nephron is the glomerulus and a tubule. When these are damaged, the filtering unit, the nephron, stops doing their job, and they may stop filtering the waste and the excess fluid from the body. Unfortunately, the heart then must pump the extra fluid not being filtered out, and this can increase the blood pressure even more. Also, damage to kidney can affect a delicate balance of hormones that the kidneys produce to regulate blood pressure and this can make the problem of hypertension even worse. Diabetes. Diabetes is the leading cause of kidney failure. Diabetes is a condition where the glucose, sugar, in your blood gets too high. Our bodies break down carbohydrates into glucose. This is used by our body for energy. To get the glucose into the cells, we need insulin, which is produced by the pancreas. It's insulin that allows the glucose in our blood to enter the cells and give us the energy we need. For people without diabetes, your pancreas regulates the glucose in your blood and senses when you need glucose, releases insulin and keeps your blood glucose at the right level. When you have diabetes, the glucose can't get into the cells and it stays in your blood. Your body can't get rid of it or use it, and your BGL, blood glucose level, will be high. There are many complications caused by diabetes, and kidney failure is one of them. There are two forms of diabetes. Type 1 insulin-dependent diabetes, IDM, usually starts in children or young adults, sudden onset. The body's own immune system destroys the cells in the pancreas and the body cannot make insulin. As the body can't make insulin, people with type 1 need to have insulin injections to control their blood glucose. Type 2, NIDDM, non-insulin-dependent diabetes mellitus, usually in older people and often linked to being overweight, coming on gradually. The pancreas still makes some insulin, not enough for proper body functioning. Sometimes this type of diabetes can be helped by losing weight and limiting sugar intake. There is then not as much work for the pancreas to do. People with this type of diabetes are often prescribed tablets, injections and sometimes insulin. Either form of diabetes can lead to kidney failure. Around 30% of type 1 patients and 10 to 40% of type 2 patients end up with renal failure. The high levels of blood glucose, or sugar, can lead to damaging the fine filters in your kidneys. Over time, the damage can cause your kidneys not to filter the blood properly and to leak protein. This is one of the early signs of kidney disease, not picked up unless you are having regular checks. The failure of the kidneys can be gradual. Many people are not aware of the damage. Symptoms show only when the failure is more progressed. Hypertension and diabetes are the two leading causes of kidney failure, and often people suffer from both illnesses at the same time. There are other conditions and diseases that can cause kidney failure. Glomerulonephritis. The immune system can cause inflammation of the glomerulus, leading to the filter in the nephron. This damage to the kidney may develop slowly and cause progressive loss of function. Polycystic kidney disease is an inherited illness that causes cysts to form on the kidneys. Some antibiotics like gentamicin can cause renal failure, and overuse of NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen. Pyelonephritis, repeated urinary tract infections, can begin in the bladder, move upstream to the kidneys. Repeated infections can lead to kidney failure. Lupus, SLE, systemic lupus erythematosus, autoimmune disease that causes inflammation in the kidneys. Scleroderma, systemic sclerosis, an autoimmune disease, can cause hardening of blood vessels which can affect the kidneys and lead to renal crisis. Interstitial nephritis, an inflammation of the kidney tubules, can be caused by autoimmune disease. Being diagnosed with chronic kidney disease can be confusing, scary, and a major change to your life. Whatever the reason your kidneys are failing, there is help from your doctors, nurses, dietitians, and support groups. Follow the advice they give you on medications and diet. This can help slow the progress of the disease to end stages renal failure. I do hope you found this video helpful. To see more videos and learn more, go to our channel https://www.youtube.com/@2inshwh. Thanks for watching. Ellen and Michael Moriarty, 2RNs.